There is a lot of work done by Dr. Bruce Patterson and Dr. Yo, and that work is about the monocytes and monocytes carrying pieces of spike protein, especially S1, in them for long period of time. This is the paper, this is the fresh
Right.
paper here, 10 January 2022,
Right.
persistence of SARS-CoV-2 S1 protein in CD16 plus monocyte in post-acute sequelae of COVID-19, up to 15 months post-infection. And so that is a very, very important paper, and they have answered a lot of questions. But I wanted to talk about one important statement here, and that is that their observation is that up to 30% of the people infected could become long COVID.
Mm.
That's a very high number. That is a pandemic in itself.
Yes.
So not only this is a disaster, but this also puts a lot of burden and responsibility on doctors who are managing chronic diseases to be aware of what is happening and how the pathologies are evolving and then how to manage. Because these patients are now part of our daily life and they're suffering and the misery just continues. So this is a great paper to look at. Then there is this paper. This is the long-term changes to blood cells triggered by COVID-19 infection. So in this study, the researchers found that it is possible that the blood cells, RBCs, WBCs, these cells can lose their morphological structure, become a little rigid. And most importantly, when RBCs do that, then you know that RBC would get stuck in various blood vessels and the clotting would occur and blood flow disruptions will occur. So that is also an important thing to keep in mind. I also wanted to say from this one monocyte, the outcome of this, if I could summarize it so you have the seed planted in your mind, that is monocyte carrying S1 and then patrolling the boundaries of the blood vessels will mean that there will be vascular inflammation. And when that vascular inflammation is towards the head and neck region, then there can be a lot of neurological disruptions. So now imagine inside the blood vessels, we are getting issues with the clotting because of, and the blood cell shape changes. And outside of the blood vessel, there are monocytes that are dysregulated. And now blood vessel is attacked from both sides and it is inflamed and the blood flow is disrupted and clotting is occurring. That is what is a possible mechanism that is happening in long COVID. Then finally, anosmia. So this is a study about anosmia. Anosmia has been a very common outcome as well during the long COVID. Interestingly, some people's anosmia recovers by itself. Some people, when we give them therapies, the anosmia recovers within a few days to weeks. And for some folks, the paresthesia of or hyposmia continues for months.
Yes.
So these are the basic studies that I wanted to first put in front of our audience. Um, so far, so good, Eric?
Yes, I said each one of them, it makes me want to dive deep. So, but I'm going to let you keep going before I take us off the path, because I want to get through these. These are just wonderful. Okay.
Absolutely. So I think what we can do is this. Today we'll talk about management so
Yeah.
that a more practical value is in front of the doctors and they
Right.
can use it. And then we can do a separate series where we can go individually for each one of these studies and discuss them in depth.
Yeah, because just to come again, they tie in, they give us a window and more insight into what we see in chronic diseases of all types. I mean, that's the beauty of this work. It doesn't stand alone. It's tying together information and data that we've been looking at and just giving us a ways of putting it into more practical, so we can really begin to use this to help patients.